Ciao e benvenuti. Hello and welcome to another episode of Richard Harris's Herbal Tutorials. The tutorials that inform and educate about herbs, natural substances, and their uses. In these podcasts, you learn how, why, when, and when not to use these agents. There's no hype, no exaggerated claims are made. I'm Richard Harris, a longtime practitioner of traditional Chinese medicine. I'm also a qualified Ayurvedic practitioner and I hold a diploma in Hirudo therapy. In this episode, I'm inviting you all to come with me as we embark on another learning experience. Most of my past videos pertain to herbs. In this podcast, I'm introducing to you another natural therapy commonly referred to as Herudo therapy, but more commonly known as medicinal leech therapy. So you may see me using the two terms interchangeably. There are lots of misconceptions about this therapy. The perception in societies around the world is leeches suck out bad or dirty blood from the body, and that's how it is used for healing. Leeches are deadly, and if you've bitten, you will die. Also, whenever they bite you, it is extremely difficult for you to get them off. Most of these beliefs are Hollywood implants. I sincerely hope that after watching this podcast, these misconceptions will be adequately addressed and a renewed interest in this therapy will be generated. Leech therapy is an ancient healing system that uses the saliva of medicinal leeches to treat various medical conditions. The uses of leech and their saliva as a therapy can be found in ancient Chinese, Indian, Arabic, Persian, Egyptian, and Roman medical texts dating back over 4,000 years. Presently, between the 18th and 20th century, leech therapy mushroomed, so much so that by the 1830s, France imported nearly 40 million leeches yearly. Other Europeans were not left behind. Between Russia, Germany, and England, millions of leeches were used. Leeches were in such high demand that steps had to be taken in Europe to protect them from extinction. Leeches had become such an integral part of medicinal treatment back then that physicians were affectionately referred to as leeches. Prior to 1822, there were no medicinal leeches in the West Indies, but the popularity of leech therapy in France and England back then resulted in the transferring of the said therapy to the islands that these countries had subjugated. Thus, after 1822, treating people with leeches spread to the West Indies and the rest of the Caribbean, especially the French-speaking islands, France being the foremost exponent of the therapy. How did medicinal leeches reach the Caribbean? The introduction of leech therapy to the Caribbean was started by the ships bringing indentured laborers from India to the West Indies. Back then, it was common for diseases to break out on these floating medical disasters. As such, ships were required to have leeches on board to address the disasters that were inevitable. Since this form of treatment was considered to be a panacea for all things medical, ships were always well stocked with these medical marvels to flatten the curve. We all know and understand that phrase, don't we? Besides their immediate need on the ships, medicinal leeches were also introduced to the West Indies, more so in the French islands by the French for breeding purposes. Considering the vast demand in France and the rest of Europe, with the advancement of Western medicine with its surgeries, antibiotics, new powerful drugs, etc., and the debunking of treating ailment with leeches as a useful medical discipline, leech therapy as a medical discipline declined considerably in most of the Western world, except maybe for countries such as India, China, and Russia, from where the new awakening would re-emerge. I remember when drugstores sold leeches. That was before we were enlightened. There's a saying, truth shall prevail, and the truth about leech being useful in treating disease prevailed. Therefore, the 20th century saw the resurgence of leech therapy in different parts of the world. Leech therapy is now being used successfully by many hospitals for cosmetic surgery and also for a number of chronic and recalcitrant diseases such as cardiovascular diseases, gangrene, and the reattachment of limbs, etc. The truth about the usefulness of leech therapy as a viable medical treatment, demonstrated by its success in treating the above-mentioned disorders, has managed to convince the skeptics that the ancients knew something. As such, medical leeches were approved by the U.S. Food and Drug Administration in June 2004 as a medical device used in the treatment of the above-mentioned conditions. If you're enjoying this video and you're learning things, why not stop briefly? Hit the subscribe button. Give it a thumbs up, like and share. Your contribution is very much appreciated. You liking, commenting, and sharing helps the algorithm and contributes immensely to the growing of the channel. Thanks for your support. For those interested in making a career of medical leech therapy, why not contact the Medical Leech Therapy Professional Training Course UK or call Yulia Kostenko at 077-2202-8588. It's affordable and she's a very good teacher. Let's continue with some more interesting facts about our useful, harmless, crawling friends. There are several types of leeches, but the ones generally used medicinally are Hirudo medicinalis, Hirudo orientalis, and Hirudo verbena, though there has been the discovery of other types over the years. These are not slugs, which are erroneously identified as leeches by the general public in the Caribbean, especially by the young generation. They are not the same family. Leeches feed on blood. They can consume about 10 times their normal body weight at feeding times. Before drawing blood, leeches secrete and inject several different types of biochemicals into the body, as it were, to prepare the blood for their meal. The therapeutic effect of leech therapy, contrary to popular opinion, is not due to the leech sucking blood, but mainly from the several types of chemicals that are injected in the bloodstream by the leech. There are more than 100 bioactive compounds found so far in the leech's saliva. I'm going to discuss a few that are found to be very important. 1. Hirudin. Presently, this is the most important of all the chemicals discovered. It is possibly the best thrombone inhibitor discovered so far. With its ability to prevent coagulation, it's much more potent than heparin. 2. Hyaluronidase. This biochemical has a strong antibiotic and antibacterial effect with its ability to kill and prevent the spreading of microorganisms. 3. Estabilase. This enzyme exhibits strong fibrinolytic activity, meaning it can break down fibrin, a key component of blood clots, and lengthen the blood clotting time, making it very useful for conditions such as thrombosis and thrombophlebitis. This enzyme is frequently used in medicine and cosmetology. 4. Collagenase. This chemical has a strong beneficial effect on dissolving keloids and other scar tissues that may result from burns, cuts, and wounds. This does so by destroying collagen from which they are made. 5. Aferase. This is another important biochemical found in the leech's saliva. It reduces blood fat, breaks up and clear plaque found in the arteries, making it very useful for arteriosclerosis. Some other important biochemicals are bradykinins, kinase, eglin, elastase, and serotonin. Interestingly, while there has been many useful drugs developed to function like those biochemicals I've just listed, none comes close to the ones found in leeches. It has been proven clinically that in the early stages of undergoing leech therapy sessions, the patient's phagocytosis dramatically increases. What is phagocytosis? Phagocytosis is an integral part of the immune system. It's a process of defending the body against pathogens and maintaining the healthy tissue. This process results in the expulsion of viruses, bacteria, and dead cells from the body. Before the procedure is done, the area is sterilized. Then the leeches are attached to the selected area. The leech attaches itself to the body quickly if the area is warm. Chemical smells such as perfumes, detergent, etc. can make it difficult for the leech to attach itself. To attach itself, the leech bites the skin. This procedure is not painful and there is no post-operational pain since the leech injects an anesthetic substance into the bite. Each treatment session lasts for approximately 30 to 60 minutes, depending on the quality of the blood. The longer the leech feeds is indicative of the unfavorable condition of the blood. The leech usually detaches on its own after being sated, or the practitioner can make it detach itself using alcohol-prepared cotton pads or other strong-smelling fragrances. The area is then bandaged, but not too tightly, so that mild bleeding could continue. After the first application, the follow-up application usually takes a shorter time because the quality of the blood is more favorable for the leeches. After the procedure is over, there is a very, very tiny Y-shaped wound which heals pretty quickly, leaving a tiny, undiscernible scar. Do you know what? This therapy shouldn't bother young people too much. They like scars, piercing, and tattoos. This is right up their alley. No, I'm not knocking young people. I'm just being funny. I like being funny sometimes. Because this procedure involves blood, and to avoid the risk of contamination, leeches used must be sourced from reputable production facilities, as opposed to leeches caught in the rivers and streams, where there may be contamination. As soon as the leeches bites you, it injects chemicals that dilates blood vessels, relieving vasospasms and allowing blood and energy to flow through the relaxed blood vessels to the organs. Leeches are also used internally to treat various disorders. They belong to the category of drugs that invigorate blood, resolve stagnation, and stop pain. They have a cool energy and a salty taste. Their influence is on the meridians of the liver and the heart. They have strong blood enlivening effect when used internally and should not be given to people suffering from anemia or if there's hemorrhaging. Some problems treated by the internal consumption of leeches are amenorrhea, fibroids, prostatitis, infertility, strokes, dysmenorrhea, various tumors, keloids, and many more. Dosage 0.5 to 2.5 grams. Caution: toxic. Avoid when there is no sign of blood stagnation or if there is anemia. Alcoholics, persons with hepatitis, severe exhaustion, and long-term uses of blood thinners should avoid this substance. Again, for those interested in making a career of medical leech therapy, please contact the Medical Leech Therapy Professional Training Course UK or call Yulia Kostenko at 077-2202-8588. I've talked a lot. I hope all learn a lot. So as usual, we'll bid each other goodbye, not farewell. I shall be back soon, Jehovah's willing, with more thought-provoking and enlightening videos. Please remember to like, share, and subscribe. Ciao, ciao. Fine alla prossima volta. That just means until the next time.